I'm saying, and I'm not particularly happy with what I'm saying, is that you have to bear that. You have to endure that.
Yeah.
Yeah.
Yeah, I would agree with that. And is there a suggestion that, okay, how do I do that? How do I increase my forbearance? How can I crank that knob up? You know, how do I have, and then going further, to have the courage to then push my rope out further? You know, that needs some courage. I mean, is there a way to willfully crank my courage dial?
Yeah, well, that's a great question. And I have a magical answer, a wishful, that's a better way of putting it. I have a wishful answer. I'm assuming that the more you act with integrity with what you really believe, the more whole you feel, the more courage you feel. There's a sort of a positive feedback loop. If I'm going to crash and burn, at least I'm going to have integrity as I crash and burn. So I'm assuming some power comes from that, from acting with integrity, that you start to, some of the doubt that you were talking about, that we live in an atmosphere or a context of doubt, some of that gets pushed out as you resolve your own contradictions and you start acting on your beliefs rather than keeping them separate. Something like that. That's my wishful thought, that the more I move in that direction, the more whole I will feel and the more forbearance I will have.
Yeah, I mean, it's like, talking in psychological terms, like the notion of self-efficacy and Albert Bandura and all like that, oh yeah, I'm now able to feel better equipped to deal with more because I've sort of rewarded or noticed myself having the capacity to do that hard thing. Okay. Yeah.
Yeah, exactly.
So, you know, I need to, you know, I need to coach myself to do that challenge and then to reward myself. If I were somebody dealing with panic or anything like that, what would stand out with me seeing you than seeing the standard cognitive behavioral therapist, you know, which most everybody is? So if I go see you, what's going to happen for me different?
I don't know that much about cognitive behavioral therapy, but my guess is that is technique orientated. It's not existentially orientated. So by that I mean it reduces everything to its most simple terms. Oh, if this happens, then do that, and you'll experience some control and some relief that way. It doesn't really want to look at, it's sort of like, it's more like symptom management, but challenge me on this if what I'm thinking is off base as far as you're concerned.
No. I just want to get a sense of
What's the
what your flavor would be, and it doesn't have to be just in context of
Here's what I would do.
Okay.
Here's what I would do. Let's say you're my client. Let's say, Mark, are you feeling any of that anxiety right now? And most people would say, yeah, as a matter of fact, I've got something like that happening. Then I would say, okay, well, where is it most intense? Where in your body do you feel it most intensely? And typically, if it's a woman, they'll say it's right here in my sternum. Men will say that as well, but they also say it's a little bit lower in their solar plexus. They might say it's there. I say, okay, what I want you to do is I want you to focus on that feeling that you're having there, but I don't want you to think. I want you to give all your attention. Just like if I pinched you right now, you could put all your attention on that pinching sensation, but you wouldn't think about it. Okay, so I want you to pay attention to that feeling, give all your attention to it, and tell me when it starts to change. Well, every time they say, well, it's changing, I say, well, was it getting worse or better, or what's that? It's getting quieter. So what I'm teaching them to do is I'm teaching them some control. And the way in the story, the narrative I give to explain why it works, I say, anxiety was originally called signal anxiety. something in you wants your attention. If you don't give it your attention, it'll get loud. And if you still don't give it attention, it'll get even louder. So that's your panic. But if you give it attention, it's okay, I can relax, I've got your attention now, it'll start to subside. So now that you know how to control your symptom, you might want to start dealing with your problem. They're different. Your symptom of panic is different than your problem with your relationship with your boss or your wife or your kid. Right? But while you're thinking about your symptom, oh my God, I'm going crazy, I'm going to pass out here, I'm going to run amok, you're not going to be able to be in any shape to deal with your relationship with your partner or with your kid or your boss. Yeah. So that's sort of what I'm...
Okay, that's... And I like that, in that, yeah, by not running from it and just focusing on the feeling, it diminishes.
Mm-hmm.
Okay, and then I feel more of a sense of control over it, and yeah, and I appreciate that. That now, the thing that comes to my mind sometimes is that, what if I'm self-initiating it? Like, there are times when people keep picking the scab to see if the sore is still there, that they keep dwelling on the ex-marriage that they torment over. Mm-hmm. You know, they don't have to attend to it. No, it's done. Oh, I'm now dwelling on it. Now I'm re-triggering terrible feelings. That, you know, is that just denial? Is that good mental hygiene? I'm selecting the things I'm going to attend to.
Mm-hmm. Well,
is that any different than denial? I don't. You know, what would you say to that?
Well, I like the way you introduced the topic about people activating their panic themselves, because I think that's what happens. Yeah. So they're scanning the horizon of possibilities for the first sign of trouble. And of course, when you look for trouble, that's what you're going to find. They think that they're heading it off at the pass when they're actually inviting it. So at my workshops, when I used to give workshops on panic disorder, I said, how will you know that you're over your panic attacks? Is when you stop expecting them.
Mm-hmm.
Yeah. You forget to expect one.
Yeah. Oh, I like that.
Yeah.
Yeah. Yeah, you're short-circuiting it.
Yeah. You're caught up in the art project you're doing or the sailing that you're going on, and you don't have room for the scanning anymore. Yeah.
Yeah. It's good.
Should we stop there?
Yeah. But not again.